I'm Monica White. I'm an acute care nurse practitioner and I work with Texas Oncology in East Texas, Longview, Texas. And I'm at JADPRO 2025. So, for experienced APPs, many of us have been around in oncology and working with this kind of procedure for many years. But if you are new to oncology, you may still be thinking, what is bone marrow biopsy even used for? So it's used for a number of different things. Bone marrow biopsies are done to stage cancers, much like multiple myeloma. We want to know the extent of the cancer. There are also patients that will come into your practice that may have some kind of a cytopenia, but it's not clear what's going on, just looking at the CBC or the slide. And so bone marrow biopsy can also be used to rule out disease. So often you'll do a bone marrow in someone who has a thrombocytopenia or has an anemia or a leukocytosis or a leukopenia, because we want to know basically, and the way I explain it to patients is that we want to know, is the factory working? So the marrow is what we're biopsying. We're not biopsying the hard part of the bone. So we're really getting some answers about how well is that part of the body and part of the bone actually making cells. And we diagnose many cancers, lymphomas, myelomas. We get to the bottom of anemia. We find leukemias because of doing the bone marrow biopsy. So it's really a tool that is used in practice for a multitude of things. Then you have the patient who, let's say, has multiple myeloma and they've been on treatment, but we're wanting to see, are they in remission? Is it holding? How are they responding to treatment? And so we in those patients, we may do multiple marrows over many years. And what you want as a practitioner is you want the person who has to have serial bone marrow biopsies, you want them to say, oh, no, if Monica can do my bone marrow, and have that confidence and know that it was not a terrible experience, that we got them through it, and that they can trust that we'll get them through it again. And so that's really one of the best compliments that I've had in practice for patients that have to have serial bone marrows is, I'll place them on the table and they'll say, I told Dr. So-and-so that if I ever had to do this again, that you're the one that I want to do it. And so it's a great compliment, and that means to me the soft side of marrow, that I've prepared them and I've helped them through the process, because nobody wants to have this. So that's a really a wonderful compliment. So if you're thinking about bone marrow biopsy and you may even have some hesitation about, is that something that I'd be good at, or could I learn it or be proficient or be confident enough to do it? This is a great setting to do that. And so I encourage you to join us next year where we can kind of start you on your path. And even if you decide it's not for you, it's something that you can be a part of on the simulator, not on a person, and find out, kind of how you can bring that into your practice.